Hello, in this lecture we're going to be talking about mummification and also about medicine. Now these are two separate fields within ancient Egyptian culture. However, I'm just kind of grouping them in similar categories. Now, we can't really talk about ancient Egypt without talking about mummification because that tends to be the thing where most people are very excited about is the Egyptian mummy. Now, mummification is not new. Many cultures had mummification, but the Egyptians took it to a very different level. And some cultures, when we're talking about different mummification, particularly in China or in Mesoamerica, there are both groups of people who do mummification. It's very different than that of Egypt, and again, this has to do with geography, um, and the setting in which Egypt is hot and dry. That really helps with mummification. Also, when we're talking about mummifications, why people are interested in it is because it's humans. We're seeing people that lived at a time, and it's a very real way of looking at humanity within Egypt. We can talk about it, you can do the readings, but sometimes just seeing a physical person who lived in this strange way in which they lived, or the fact that in some mummies that we can see what they ate, what they dressed like, what was important to them. And mummification is very central into the religions of ancient Egyptians, and not everyone could or did do mummification. It tends to be in the higher echelons of Egyptian culture, primarily with pharaohs, but also you get some with aristocrats and very important people. Um, but we're going to talk about the methods of how to embalm or treat the dead of ancient Egypt, in the process in which it's really with Egyptians is the removal of all moisture from a body, only leaving the dried form that did not decay as easily. It's important in that it is part of that you have to have that physical body to go into the afterlife. And so the desecration of mummies was seen as one of the worst things that could happen, particularly to a pharaoh who was supposed to have that rebirth again. Um, we could view the mummifications of Egypt and about what they looked like 3,000 years ago, and that's really important. Mummification was practiced in early Egypt, but somewhat accidentally in the pre-dynastic period because it was hot and dry, and air tends to remove all moisture. So um, prior to that, to preserve bodies, they were put in shallow pits and covered with sand, and the sand would dry that out. You wanted to make it more and more deep as time went along to avoid predators. That was really important. But by the 4th and 5th dynasties, Egyptians began to properly mummify their dead. This practice continued for well over 2,000 years into the Roman period between 30 BC and AD 346 or 64. Um, and there are particular periods in which mummification was at its height, particularly in the 18th through the 20th dynasties of the New Kingdom, and that's circa 1570 to about 1075 BCE. And of those, one of the most famous that we have records of is, of course, Tutankhamun. Who was Tutankhamun at first, because his father was Akhenaten, but he changes his name to Tutankhamun, back to saying that he's polytheistic, which is very important. Now, however, we need to talk about the process. The mummification took 70 days. It required special priests, workers, embalmers, treating and wrapping the body, and beyond knowing the correct rituals and prayers to be performed at various stages, the priest also needed a detailed knowledge of human anatomy. And before I go on, when we're talking about medicine, doctors did not perform mummification, so they would not have had the same information about human anatomy as did those priests. So that's kind of a common misconception that they said, oh wait, because ancient Egyptians practiced mummification, that means their doctors knew a lot about anatomy, and that is not true. So the first steps of mummification is the removal of the internal organs that are going to decay. The brain was carefully removed by inserting a special hook instrument up through the nasal passage and pulled out bits of brain tissue through the nose. It was a delicate operation and that could easily disfigure the face. And you didn't want to disfigure the face because they needed the correctness of their likeness into the afterworld. If you disfigured the body, you disfigured the afterlife. The embalmers then remove the organs in the abdomen, usually through a cut that's about 2-3 inches in the abdomen. So chances are they actually didn't know a lot about anatomy from the small cavern, in which they removed all the organs except the heart. The heart was believed to be where a person's being was, their ka, their soul, their intelligence. All the other organs were removed and separately placed into canoptic jars, such as the stomach, liver, lungs, intestines were placed. And you needed to have all the canoptic jars to go with you into the afterworld. And this was a very much a spirit, a ceremonial view. The mummies, these were buried, the canoptic jars were buried with the mummies. Later mummies, the organs were treated, wrapped, and replaced within the body, and the unused canoptic jars continued part of the burial process. The embalmers next removed all the moisture from the body, and they did this by covering the body with natron, a type of salt that had great drying properties, and it would remove all of, they would put packets inside the body to remove all the moisture. The embalmers dried out and then they washed off the bodies. The result from the is a very dried out, recognizable human form. And to make the mummies seem even more lifelike, sunken areas of the body were filled with linen to like pack it so you looked human again, including having false eyes added. The next began the wrapping process, and each mummy needed hundreds of yards of linen, and the priest carefully, with long strips of linen, wrapped the body. And every time, each finger, toe separately, they wrapped everything, every foot, and it was very methodical, and you had to be very, very careful. Any mishaps would hurt the dead in the afterlife. Amulets were placed in the wrapping, prayers were put on the wrapping, magical words to help the person in the afterlife. Often priests placed masks on a person's face or the layer of the head with bandages, and several stages were coated with warm resin. And the wrapping resumed again. The last phase, the priest wrapped final clothes, the shroud in which they are going to the afterlife, and that was the completed mummy. The priest preparing the mummy were very busy during the time, but also you had preparations for the tomb that oft, as soon as you became pharaoh, you prepared for your tomb in the afterworld, either a Saqqara or the Valley of the Kings. That was really important to do this. In the 18th dynasty, as we already said, was very wealthy, so some of these they had started one in Saqqara and then had one in the Valley of the Kings, depending on their view of life, or sorry, where they were going to remained entombed. It was a very magical process. They had lots of models and pictures and lists to make sure that you said the right prayer at the right time. As part of the funeral, priests performed special religious rites at the tomb's entrance. The most important of these is called the opening of the mouth. A priest touched various parts of the mummy with a special instrument to open the body parts, the senses, so that they can enjoy them in the afterlife. And by touching the instrument to the mouth, the dead person could speak and eat. And that was really important because to have a good, successful afterlife, you wanted to be able to eat and speak and communicate and continue living your life. The mummy was then placed in coffins, or later, and these coffins could be placed in sarcophagi, and those were in various shapes. The burial process was very elaborate. It was a preoccupation of thoughts because your life continued after death. Your life on earth was fleeting. Your life in the afterlife was far more important, and we'll talk a little bit about this when we're talking about religion. It was very important to preserve the three ideas of spirits, and this is the Ka, the Ba, and the Ah. The ka is the person's life force. The ba is the spirit, and the ah is kind of sorry. The ba is the personification of your personality, and then you have the ah, which is your spirit that would travel and go to the underworld. And so that's kind of how mummification worked in a nutshell. We have some examples of this. We have some not good examples of it. But it was primarily done if you were wealthy and could afford it, or if you were the pharaoh. Rarely did the average person have that kind of burial. And we'll talk about the average person's idea of the afterlife when we are talking about religion. Now, medicine, on the other hand, was a very different realm. It wasn't the same as mummification. Medicine was viewed as both clinical and magical, and we have various papyri that show medicine. Medicine was very important, and we know that it was so important to their culture because they wrote it down. Not only did they write it down, but we have multiple things of writing it down, and they have a real intelligence when it comes to a lot of the medicine that's performed, and some of it is more magical. And we know from the papyri that are um, still around, we can tell a lot about it. And so I'm going to talk about three separate papyri. The Edwin Smith papyrus, which is circa 3000, it could be as early as 3000, but for sure by 16 BCE, because that's where we have a copy of it. Now, the papyri that we're going to talk about are all named for the people who discover it or who own it today, or who owned it upon the discovery. That's why it's the Edwin Smith papyrus. It is not what it was named at the time. You have the Ebers papyrus, which is circa 1550, which concluded about 877 prescriptions within it. And then you have the gynecological papyrus, which is 1800 to BCE. Now, it is really important to understand that the physician was considered quite the person. They were lower than the priest and lower than the person doing mummification, but they were something that medicine was very important. And for example, we're going to look a lot at the Edwin Smith papyrus and how that was viewed. One of the elements of the Edwin Smith papyrus is that every physician had three questions, or answered three answers that they were given. And the three was that they had statements. And it was very concerned about how to state this to someone you were about to treat. So you have the first statement that I will treat the ailment, saying that I'm going to treat it, and that's okay. You can also say that the wound is contestable. I will treat it, but the outcome is not good. Or you could have the final one, which is the ailment is untreatable. Now, the Edwin Smith papyrus has a lot of clinical medicine, and it usually has to deal with broken bones. Like for very definitive, like a stone falls on your foot, you break your foot. How are you going to deal with this? You were shot with an arrow. How are you going to deal with it? So very setting of bones, of doing that kind of thing. There's not a lot of depth of the medicine. It's often like you broke your leg. This is how you're going to deal with it. In each one of the ways you deal with it, you have to answer, is it treatable? Is it contestable? Is it not treatable? This is very important because a doctor's views on of how good they are is by reputation alone. So if you're treating everything and you have a large amount of patients die, and this is very important for early medicine, you have a lot of patients die, then you're considered not to be a good doctor. So your life is not going to deal with this. So the Edwin Smith papyrus sets up the answers to this. So say you get hit in the head with a stone, which is in there. You're probably going to say the ailment is untreatable. Now, remember, the brain is not viewed as the intellectual center. They don't know what the brain is really for. They do know what it looks like, judging by various ailments. In fact, one of the big prescriptions is that someone's hit in the head. You can see their brain. You take an ostrich eggshell and you put it in there, and hopefully the ostrich egg will help heal it. So there's a lot of that kind of magical, what we're calling magical and mythical ways of looking at medicine. You have a lot of prayers that are associated with this. In fact, in the Edwin Smith papyrus, you have even anti-aging wrinkle cream that is around of how to make an old man young. So there's really a miracle cream that is viewed with this. You have dentistry. Dentistry is really important. In fact, you have papyri just dedicated to dentistry. Teeth were very important to ancient cultures. And in fact, Akhenaten had very poor teeth, and a lot of people viewed that his view on life was changed because of his teeth. You have blindness, for example, how to treat blindness. Even blindness was considered a very mythical, very magical at times. The ailment was viewed as the sun that is dark all the time. And whether by disease or other things, but it has to do with the myth of Horus. Horus gets in a fight, he loses part of his eye. You have one of the goddesses, she puts the eye back in and he can see again. So the eye of Horus is usually prescribed for anything that has to deal with blindness. But there's entire subcategories on blindness in general. There's also with the gynecological, you have birth control, you have how to do abortions, how to stave off pregnancy, what kind of infections to look for. And sometimes they were very accurate. The fact that you put a little pebble and you have an IUD to keep your uterus from closing was a view. You also have, in fact, in the papyri, you even have proctologist, which is Niru Nephit, which is literally translates as the shepherd of the anus. So there's a lot of views that you have with medicine. Medicine was seen as the height. In fact, ancient Greeks often wished that they were trained because ancient Egypt was seen as the height of medicine. So ancient Greeks were saying, physicians saying, I wish I was trained in Egypt because they allowed people to have dissection a little bit more. Not the same as mummification kind of level dissection, but they understood that there was some kind of circulatory system. They didn't have it quite right, but they understood that there was something that moved the blood through. In Greece, medicine is very limited, in fact, in Rome as well. And so a lot of people wish they were trained in the epicenter, which is in Egypt. Egypt also had a lot of clinics that started out. You had temples, there were certain temples that you could go to for healing. Now, temples were usually just done for pharaohs and for the priests, but the fact that you had someone from every day who could go spend the night, and you would have this dream and the gods would come down and tell you how to fix your ailment. That was really important for the ancient Egyptians. So their medicine was very advanced for ancient cultures. Some of it was good, some of it was bad. Sometimes it didn't quite make sense. They had, well, you can treat stomach ailments, you can treat these things. Sometimes they had really sometimes it would have worked, like for colicky babies. There's one of the potions that you would put together, and they were called potions. One of the potions you would put together had opium in it, and so it may have helped reduce colicky babies from as much pain because you would put essence of poppies in it. Medicine was very important to everyday life because it helped your life not only in the afterward. Again, if you are maimed in this life, you're going to be maimed in the afterworld. So it was really important to be as healthy as possible. They also kind of invented the idea of you go to places for spa treatments. This idea that you have rest and rejuvenation with water. Water was the essence of life. So I hope you learned a lot about mummification and Egyptian medicine.